We're on.
We're recording.
Hello, everybody. Welcome back to Medical Monday.
Hey, everybody. Welcome back. We forgot to celebrate last week. This is our 21st episode.
21.
Oh, we're
time
legal.
to celebrate.
Yes.
Time to celebrate. But we're actually going to talk about a topic with a long name, but it's very simple.
Yes.
They actually simplified the name, and it's called slap tear. Slap tear is a superior labrum anterior posterior tear. Very complicated. That's why we just call it slap. But this injury you get oftentimes with athletes, whether they're throwing a ball or throwing a javelin, and it's not actually the throwing motion forward,
Nope.
It's the heavy cock back that'll cause the damage. And that's why we also see this in people doing labor work.
Mm-hmm.
Whether you're in the construction business, you got a big hammer or a sledgehammer, the cock back is what can cause this tear.
Yes, that is very true. And it like everything you just said is 100% correct. There's nothing else to add to that except to just comment and repeat it, right? And so it's not so much the action that you're after in the throw or the hammer hit. It's actually the pullback and just hyperextending. It just goes farther than it's actually designed to go, and the body gives in.
That's why it has a very long name. Because if we look at the anatomy of the shoulder and what actually happens, you'll see.
Yes.
This is the front of the chest, right?
Looking at
the
this.
Superior, which is the top part.
Mm-hmm.
The labrum, which is the covering of the shoulder.
Right.
Anterior, posterior. That's forward to back. So the top of the shoulder, the casing, the tear happens on the forward portion going towards the back.
Yep.
So that is why you have this motion is what causes that tear.
Yep. And it does it's like fraying is how I would describe it. That joint capsule you were talking about it frays and pulls from the joint space slightly, and there are different grades of it.
And we like the fraying. That's grade 1, and it's very, very treatable.
Yes, very treatable. In fact, rehab is the way to go.
Definitely so. With rehab being so important with it, we look at right here in the Houston area, the Houston Methodists, their orthopedic center noted in a great study that about 40% of professional athletes that have this tear don't need surgery. Now, that's a good statistic.
That is a very good statistic.
They don't need surgery. These are professional athletes. So, it's a pretty good damage if it's one of these guys or gals, but they don't need surgery. Only thing they really needed, rehab. Rehab did the job for them.
Absolutely. And what's great is, yes, it's wonderful to have this professionally supervised, but there's actually quite a bit you can do at home. So there's a lot of resources online regarding these exercises, and there's 4 basic movements. There's 4 basic movements that need to really be targeted, and that's going to be rotating that shoulder out, rotating that shoulder out, rotating that shoulder in, and then going forward and backwards. So 4 basic movements that are hit on, and so
those are the major muscle groups that move the shoulder, because oftentimes of the slap tear, there's other injuries. We got rotator cuff injuries, and that is why when we're treating a patient with a slap tear, you always make sure you do multiple tests, because you're going to catch a couple of other deficiencies within the arm that you also want to treat, like rotator cuff, for instance. A lot of people say, I might have a slap tear because at nighttime it hurts me to sleep. Well, that's actually a cuff injury, not a labrum issue. So we do multiple tests, we narrow it down so you can get specific on the rehab.
Yes, and when we talk about the shoulder, it's very important to specifically know what's wrong with it. Occasionally,
so Google's good, but be careful. Be very careful.
Very true, very true. And so that's what the exam process for, is to filter through and truly find what is wrong with the shoulder.
Yep.
So very true, very true. So yes, rehab is the absolute best way to take care of a slap tear, but surgery is needed. Absolutely needed. Depends on how severe it is, what actually onset the slap tear, because if it is a fallback type issue, it might be a little worse than just the fraying. And so yes,
that's why it's graded.
Necessary.
That's why it's graded on a scale of 1 to 4, kind of what happened. If you're just hitting a hammer and you got a little bit of fraying in there, great. We can do some rehab, but what we do see is, say you're a little bit older, one of the injuries is your arm, as if your arm is behind you when you fall back to try and catch yourself. That can cause a pretty significant tear, especially as we age.
Yes.
Well, we do have great surgeries, but we do know that if you're older, over 36 years of age, the Naval Center in San Diego noted that about 40% of those surgeries do not fix the problem. So when we want to really be careful as we age, because we'll get more injuries and they're not very treatable with surgery, because that's kind of a flip of a coin. 40% is it's basically 50-50. You know, you're getting up into that range. It's like, well, maybe it does something and maybe it doesn't. So, you know, be very careful to where you don't stretch your arm out. Or as we age, you know, we want to be very careful of our mechanics when we are throwing a baseball out in the backyard.
Yes.
We're not 18 anymore. When the grandkids come over, when you're in the backyard trying to heave the ball, just be very careful.
Trying to keep up with the young ones. Yeah, I'm glad mine are. I'm glad I'm younger.
Yeah.
My kids are younger too, so.
I'm over that 36-year mark.
Oh, Lonnie, I'm sorry to hear that.
I need to be careful.
I'm sorry. Yes. So the other important thing is we can actually help with a lot of this here in the office. We can take care of the exam. We can really hone in and figure out what exactly is wrong with the shoulder. And then absolutely, we do rehab here. So one of the things that we specialize in is rehab to make sure that we work on the different areas. And resistance is required sometimes. So we do actually have a setup for shoulder rehab to work through this process and get the strength back that we need to, like I said, internally and externally rotate that shoulder. It's a movement that's very basic. And sometimes in regards to exercise, you have to hone in on those specific movements and just focus in on the areas that need focus.
And when you're doing rehab, always be careful. You know, if it hurts, it's not good rehab. You want to push yourself, but just like anything else, if it hurts, you want to bring it down a little bit and make it easier for you. Those resistance bands are great, but just be mindful of how much resistance we're putting on ourselves.
Yes, and these are things we have here in the office. We're also showing it didn't play again.
Wow. But
yes,
if you have a tear, that's going to have dysfunction within that joint space. So what do we want to do?
Align it.
Yep.
Yeah, we've got to support it mechanically. If there's a problem with one of your tires on the car's not going to run right because it can't roll down, drive down the street properly. And it's the same thing in our body. If you have an issue with your shoulder, it is very, very likely that you have an issue with the neck as well as the mid back here, and then down into the elbow. You have to check above and below where that joint problem is and support it through that process, or else all the compensation just trickle effects into additional problems. So let's just target the problem and work with everything else as it goes through. We can do manual adjustments. We can do instrument adjustments, all based on what current state you're in. So if you're in an acute state and although you're looking good, but you're in a lot of pain, we can work with that. We work with all types.
All types.
Yes.
But we know with labrum tear, especially if it's grade 1, it's very treatable and it's going to heal. However, if you need to heal much faster and also heal with a much stronger shoulder, what we do is regenerative medicine. Regenerative medicine is going to help your body heal faster and give you that strength back. You know, we looked at those professional athletes, about 40% of them do not require surgery because about 93% of all sports teams utilize regenerative therapies on their players. They want to get them back. But if you're a worker, you want to get back to work too. And this is actually our regenerative cells. We pull them out there on liquid nitrogen, about 180 degrees, stored right here in the office to where we'll be able to treat patients same day and really start that healing process so they can get back out on the field, whether it's the field of play or the field of work. So that's what's really going to help you know enough about slap tears to where you've got some great options to use at home.
Yes.
You've got some alternatives and some of the things we do here, but really some great understanding of what a slap tear is.
What a slap tear is. It is actually a tear in the shoulder, not an action.
Not an action.
Correct.
Could be. Could you get a slap tear with the?
You could actually.
It depends on how hard of a pull back for the slap would be.
It depends on how much. Yeah. How far back are you going?
But it's a great topic, a long name for it, but it's very simplified. There's great options for treatment out there, and I hope you guys learned a lot about our Medical Monday on slap tears.
Yes. Awesome.
And we'll see y'all next week.
Thanks for joining us.
Much better.
Yes.
Much better.